I don't know what happened. I hope it wasn't me.
I think maybe I jinked it and then it crashed. Everything just like froze. I had to like completely close the app and then restart again. So sorry about that.
Oh, okay. Well, good. Well, at least we're back on here. So, well, I
Yes.
think I was just kind of saying that, I started very traditionally and I had my own personal issues with my own hormone imbalance and endometriosis and fertility. So I started really more about that. And then at that time was when the big study came out 20 years ago about female hormones. So I became a certified menopause practitioner and just really concentrate on female hormones, menopause, perimenopause. And then the more you learn, you realize the less you know. So, I heard about a functional medicine fellowship, did that through the American Academy of Anti-Aging and Regenerative Medicine. And then I was able to actually also grandfather and to take a third board certification in integrative medicine. So I'm a lifelong learner. I'm constantly attending courses. I'm also great to, I'm lucky enough to teach these courses as well. So that's kind of been my heart to help people because I feel like I know, well, I don't feel like I know as a traditional OBGYN, we're not taught anything about PMS treatments, control pills, or why it's happening, or really any hormone issues. It's like hormone issues in teens, maybe hormone issues to get you pregnant. And then let's prevent pregnancy. And in the absence of that, there's really not a lot that we're taught. So it's a big vacuum as far as our traditional education and really even just even in like naturopathic education or anything else.
That's amazing. I felt like your patients are like so benefiting from your life learner like experience and all these knowledge. So what is the functional and integrative OBGYN? You mentioned a little bit.
Sure. So if I start with integrative medicine usually it used to be called alternative, but it's not. Alternative would imply that you aren't doing traditional medicine. It's not, that's not the case. Integrative would say maybe you have high cholesterol and you're going to, or maybe you have a headache, a migraine, and you're going to take your medications for your migraine, but you might also go get acupuncture or a massage or chiropractic care that would also help. You'll take your medication for migraines and then you'll do your or some integrative therapy. So it's something that in addition to mainstream medicine, you may be looking to kind of complement what you're doing. And so that mainly could be Ayurveda. A lot of it, lifestyle medicine is involved in that, which I'm very passionate about prevention and health and wellness. And then functional medicine is more the approach to a disease. So if I go back to that headache patient, instead of saying, here, take this for your headache, and then let's give you acupuncture, I'm going to think, why do you have a headache? Do you have hormone issues? Is it your female hormones? What time of your cycle does it happen? Is it nutrient imbalances? Is it something in your gut? And I'm going to go through looking for the cause. The thought is if you treat the cause, then you won't have the symptom anymore, where traditional medicine is pretty aimed at symptomatic treatment.
I love this. Not only you're looking at the causes, but you have so many tools in your toolbox to really integrate everything to offer patient like really personalized care, which is like so lacking in like a traditional medicine.
I think you hit it on the head. I mean, that personalized medicine with whether you're a teenager with irregular periods, whether you're a 45-year-old, that's what I really love about what we do, is that it is personalized to the patient. And also, I might say, hey, you need to stop eating gluten. And you might look at me like, I'm never going to stop eating gluten. Right. And we say, okay, that's a deal breaker. Go ahead and eat your gluten and then we'll try to do this. Right. I mean, it's okay. If you're not going to listen to me, then that's the end of it. So we try to meet patients where they are and give them the option. So I'm getting to the root cause of it. And then I'm saying, here are all the options. What do you like? What do you want to do? And it's a partnership with me and the patient.
Which actually is going to be way more effective, especially when we talk about managing these like lifelong like chronic conditions that people really need. Because if you don't have the partnership, like nobody's going to listen.
Well, I think that, yeah, I mean, I think, when we hit things like COVID, we all separated and some people are working from home and all that kind of thing. So we need that connection and a lot of medicine. While I love telemedicine, it lets us reach a lot of people. I think for some people, it really depersonalized that interaction. And so patients, I feel that they just want to be heard and validated and someone who's going to help them with their thing. And so in some things you can do it, in some you can't. Like in cancer care, it's hard to deviate from the plan, was studied, but in other things you can do it that way.
Such as PMS, which we're going to talk about today. So,
Yeah.
like I briefly mentioned a little bit about PMS. Could you explain what exactly is PMS?
So PMS is a constellation of symptoms that is linked to the menstrual cycle, and it's most traditionally the week before your period starts. So it's in that time between the release of the egg or ovulation and the period starting. It's generally due to the fluctuation of hormones. When you're having a menstrual cycle, the first day of your period is day one. When you're bleeding, your brain is already trying to get the egg to grow. As the egg grows, it produces estradiol. The whole purpose is for reproduction. So the middle of the cycle, you ovulate, and then the shell of the egg produces progesterone. If there's no conception, no egg and sperm, the hormones fall. And during that time, that premenstrual area is when people get symptoms from that fall and change in hormones. And, the way medicine works now is unless there is a drug or a profit, nobody's going to do a study on a treatment, right? So PMS, you can live with it. And, I hate to be, on my feminist soapbox, but a lot of if you haven't experienced it personally and you're a reader, why would you try to study that unless it's, now we have this designation that's PMDD, which is like one step further worse. Like PMS is a little milder form. PMD is premenstrual dysphoric disorder. It now has what we call a DSM diagnosis, which is our book of diagnoses of mental health. So you can have some people with very severe symptoms, and those people, again, there might be some impetus to do research, but otherwise, a lot of the therapies that we employ, whether it's supplement, lifestyle, hormone balancing, there's no profit in it. So we won't have a lot of studies driven to find that.
Yeah. So what are some like most common symptoms of PMS?
So during that time, the one you probably hear the most about is the mood fluctuation, whether it's irritability, some people are really weepy, some people are angry and just get rage, and people just kind of get depressed. A lot of women have physical symptoms from water retention, bloating, breast tenderness, even bowel changes. Some people have loose stool from that shift in fluid. Like I said, breast tenderness. As you get a little bit older, you might have more symptoms of night sweats, headaches during that time, and sleep. But the ones that are the most common in the younger women, teens, 20s, 30s, would probably be the mood issues.
Mm. Yeah. So how does like a coffee and alcohol play a role in like these symptoms? Because some people have like a huge like reaction to certain things.
So the female hormones don't exist in isolation. They're very connected to your adrenal hormones. Your adrenal hormones, cortisol, and cortisol, it has what we call a circadian rhythm. Cortisol exists to prepare your body to run from a bear. So up when you're having so caffeine is a stimulant, and caffeine also can make fibrocystic breast tissue worse. So caffeine in moderate, I feel, is okay. When people are drinking a lot of caffeine, it's going to stimulate everything. It's going to increase your cortisol, which slows down your body's ability to clear estrogen. So alcohol, that's what alcohol does as well. It slows the clearance of estrogen. So if you have estrogen dropping and progesterone dropping, then you get a little bit of imbalance with estrogen higher than progesterone. So estrogen is a growth hormone, so it's going to make you have more water retention, more breast tenderness, a thicker growth of the uterine lining, so a heavier period. And progesterone is going to try to counteract that. So if you have more estrogen than progesterone, those symptoms a lot of times can be heightened.
So this makes also balancing these hormones extremely important. So if you have symptoms already, it's better to make sure you don't make it worse by consuming certain things.
Right. And so one of the therapies that is often recommended is to limit caffeine and to decrease or eliminate alcohol during that time period as well.
Yeah. So you had a great post about other causes of PMS on your feed, which you mentioned about gut health. So how does your microbiome actually like impacts like your period?
Well, that's what's so fascinating is when I went to didn't know anything about the microbiome, about anything, bacteria was bad. So this is all really new science. And now we realize we're probably more made up of this bacteria than we are of our own DNA cells. And so when we're talking about getting rid of estrogen, for example, it's a two-step process in the liver. That's what we call estrogen detoxification. But then after that chemical reaction happens in the liver, it dumps into the gut. So if you're not eliminating, I mean, normal pooping is twice a day. So if you're not eliminating, it's as if in the liver, they took estrogen, put it in a box, tied it, and sent it down the chute down to the gut. And then that gut bacteria, if you have too much gut bacteria, it will increase an enzyme called beta glucuronidase, which will essentially open up packages and send that estrogen back into your system. So then it's still going to have an effect on it. You're not getting progesterone sent back the same way. It's not the same hormone. So then you're widening that imbalance for patients.
Oh wow. That's super fascinating.
Well, and again, since this is not something that I was really taught, I mean, and I was proficient at measuring hormones, replacing hormones, but then before I really learned more about the gut, which was really what you think about for an OB, I was missing that piece. I was like, why is this patient not getting better or what the issue is? Think about people who are constipated. They're not clearing the estrogen as well. So it's an important part of our detoxification for anything, not just estrogen and testosterone, but really I'm amazed at how much even just like eating more fiber, which is going to obviously make you more regular, can help get rid of estrogen.
Hmm. So we're a big fan of detoxification and environmental toxicants. So how do environmental toxicants like impact PMS symptoms?
So, full disclosure, I wish I knew more about this topic. I'm not an expert on environmental toxins, but it has everything to do with, in a couple ways. One, they're endocrine disruptors. And so you have them that they actually mimic the effective estrogen and other compounds. So you've got estrogen, and then you've got compounds that are mimicking more estrogen. Then they actually affect the enzymes. So the enzymes that detoxify your anything, including your estrogen, can be either induced or inhibited by other things. So a lot of times these environmental toxins can slow the enzyme down. So that's like a highway. So if you're thinking your highway usually is 4 lanes and now you've got 2 lanes and there's a bottleneck, it's not getting out. So one of the things that we usually tell patients to do is really look at their skincare, right? Do you have toxins, phthalates, parabens in your skincare? Two, just eliminating plastic disposable water bottle, Tupperware. I did that a few years back. Use the glass, don't microwave in the popcorn. A reusable water bottle and I just fill it up, from my reverse osmosis. So trying to really decrease your toxic load, that's a whole specialty in and of itself in functional medicine that, again, like I said, I'm not like the expert in, but as it relates to estrogen, absolutely huge thing to do with it.
Love it. Love it. So what about exercise? Because the also lack of exercise can perpetuate like PMS symptoms.
So estrogen is going to have a direct effect on your cortisol. Not only just having an exercise, you're going to get more what's called BDNF, which is brain-derived neurotrophic factor, which does affect your mood. And so when we talk about, and I guess I didn't really talk specifically about the gut and serotonin being not your chill neurotransmitter, but like your joy, your happy neurotransmitter. And estrogen and serotonin are like best friends. So when you have an unhealthy gut, you're going to have mood, which can manifest worse at PMS time. In addition, when you talk about exercise, you're actually increasing BDNF, which is brain-derived neurotropic factor, which is a positive about exercise. Like we talk about that runner's high, but actually also going to really help make sure you're detoxing. It helps your gut work better. and it affects your cortisol positively. Like if you're someone who's super stressed, it's going to dispel it. And I had actually a patient that I saw this week. She said, I realized I was doing too much exercise. I was doing so much high intensity interval training because, what happens as women, we hit our 40s and we start if you have too much estrogen or you're on balance, you start putting on weight. You do.
Yep.
You exercise more, you eat less. That doesn't work if your hormones are unbalanced. Exercise is good to maintain weight, but not really to lose weight all the time, right? Unless somebody who's really just not moving and isn't eating a lot. So, some of our patients have too much exercise, too much high, increasing their cortisol, and then it affects their insulin and their metabolic factors. So it starts becoming a problem that way as well. So the key is moderation, but exercise generally is going to boost your mood and help for PMS and help make sure that are also, it's helping your estrogen detoxification.
Yeah, this makes a lot of sense. People who are experiencing hormone balance, it's really important to work with a practitioner who actually knows, like how to actually balance this versus like yourself go out like trying to exercise too much, which then like actually have the opposite effect that you want.
But that's what women are told. Oh, just exercise more and eat less, right? And these poor women are like, but I'm doing CrossFit 5 days a week. And then they're not like but they feel like they're failing because they're not able to. So many women, I mean, there's actually data, even when we fast forward to menopause, that just low estrogen makes you gain weight, makes your metabolic rate. So hormone issues are not in people's minds, but I think we're on the street. Yeah. Even my traditional colleagues, unfortunately, it's still that, it's just, you can just eat less and exercise more. I feel so bad for these women.
Yeah. So besides moderate exercise, what are some things that we can do to help alleviate PMS symptoms?
Well, so if we think about, like I said, the data is a little bit skewed because it depends on what's actually been studied. And so for some reason, calcium always coming up as a positive. Honestly, it's not something that I always remember to recommend for patients because I just, in my practice, it's not my go-to thing. But there is a lot of data about calcium. Magnesium, huge. Magnesium is involved in over 400 processes in your body, and that can be really helpful to patients just to help your estrogen detox, help you relax, help your gut, and everything like that. B complex vitamins are also important in the detoxification enzyme, so be helpful for women too. There's some data that things like evening primrose oil and fish oil, being like the fatty oils, can help. Fish oil, specifically DHA, if you're really mood heavy and having issues like that, DHA can really help for your mood and your brain. But the evening primrose oil and those fat omega, fatty acids can really be helpful for PMS.
Mm. So earlier you mentioned about PMS and then PMDD as a more severe form of PMS. So what are some like significant differences? Like what should people, if someone suspect that they might have PMDD, like what kind of signs should they be looking out for?
Well, and again, I'd have to really pull out the DSM, manual to actually tell you the correct diagnostic criteria. But I can tell you if it's severe enough that you're having things like rage, that you are having suicidal ideation, like you are despondent, or you are having, crying, anxiety, things that are interrupting your normal functioning. I do think that's a severe issue, interrupting your relationships. That is important too. So again, there are medications that are traditionally indicated, and some people need to take them. I'm not having anything bad to say about that. I would encourage people to do, like I said, the integrative therapy, where maybe you're taking the medication you need along with some of the supplements I mentioned, some of the lifestyle modifications that you mentioned as well.
You have like boot camps, workshop, courses, so much material on your website. And then you also have the thyroid workshop this Thursday. So tell us a bit about that and how can people join?
So I spent so long teaching, and I teach the OBGYN residents at my hospital. So I had so much content. When it was COVID, and we were trapped and we couldn't travel on spring break, my colleague and I were like, well, let's make an online course, so we just recorded it and made it. And then it felt a way for people to, like, if you're in either a rural area that you can't find somebody who practices this type of medicine, or be motivated to, do the lifestyle modifications and detail and you want to know, we created this online course. And I think it just got renamed. So goes through the physiology of the hormones. It goes through supplements that could help, what type of testing we do, goes through the genetics that affect your estrogen metabolism. There's a little bit on like Candida. So that's kind of up. It's, well, I guess you would call asynchronous now. That's there. The other thing we did kind of during the shutdown is we've done a live boot camp. We don't have a date set yet. We usually do that kind of thing like after New Year's, when people want to like get back on track.
Yeah,
after
New Year resolution.
Yeah, so it's a 5-day, and we go through, and actually there's a day that we do environmental toxins and talk about that. So it's mainly like, again, if you were somebody who didn't have access to a provider and you wanted to join the community, we go through kind of like we've got a challenge every day for you. And so we did that live. We've done it like 3 or 4 times. I know one time we had like 14 different states and 7 countries. So that was cool because people could join, not from, I'm limited to my medical license. I can only work with patients that are in Ohio, Florida, or Montana. So if someone's not in that state and I'm not able to travel, we were still trying to figure out how can we help people, because, hearing about people who are suffering and not being heard and not being validated, that's what us to create, that. So some of them are live. So this Thursday, as you mentioned, we do have a thyroid workshop. And the little bit different about this is we partnered with the lab testing company. So we're able to get the lab testing that's an at-home kit to the patient. So that's something that started, and we'll probably roll out something for hormone testing as well, just trying to work out, those labs. Unfortunately, the price point is kind of, that's lab's price. I mean, we don't have a choice with the cost of the testing. So we're working on that too. But a lot of the modules, there is a module on PMS and anxiety and causes of anxiety. So those are pre-recorded that people can just go to the site. It's hormone-guru.com and just, kind of pick and choose what they want, or they can participate in a live workshop. Thursday is a live call, but it will be recorded for people that can't make it. And I know that there's been some people signed up this week that won't get their test kit before. So we'll mail them the test kit, and then when they get the results, there'll be a discussion board that they can at least get, some information back about the testing. But it's basically just been a way to try to reach more people, and how can we help, without, under the constraints of a medical license. We can't treat everybody. We can't give medical advice, but can we do anything that might help them or point them in the direction of somebody who can? So that's really where that all comes from. And it's just up there for anyone who's interested.
That's amazing, because we checked it out and it's so comprehensive and it's amazing.
Say it is. It's like we're undervalued. We've been told we need to raise the prices, but my partner and I, like, we have a heart. We're not in it to like get like a lot of sales. We just have, there's so many downloads, so many questionnaires, so many PDFs involved in the courses too. And there's a lot packed into there. So
amazing. But you also have the free resource, because you have a free guide that called What You Must Know About Women's Hormones. So like, what can people expect from this resource?
I think, we just want to kind of, I get asked a lot, like, who do I go to? What do I ask for? So in there, I think there's a couple of directories where I would recommend trying to find a provider. What should you be asking about testing? What testing to have? So kind of just a little basic, guide for people to get them started. And that's a free download that's there as well. And up on the course, we do have some free workshops as well, like stress. We recorded one during COVID. We have a lot of free ones up there as well, as the ones for a nominal fee.
Amazing. I like totally encourage everyone to check out all these resources. We do have one question. Women with total hysterectomy, not taking hormones, age 62 years, and has hypothyroidism. What do you suggest for women in this category?
Yeah, so for thyroid, the thyroid is directly connected to your estrogen levels, whether they're high or low, and also your adrenal gland. That's the piece that a lot of people actually miss because they're just looking at TSH. And so they're not looking at the whole. Other hormones are the ones that are going to be affected by cortisol, estrogen, binding proteins. And so, again, the body wasn't created one system at a time, it was created all together. So that's kind of what we would look at in that type of patient, whether you're taking hormones or not. A lot of people choose not to, and I think hormones aren't for everyone in menopause. But what our job is to see where you are, where your levels are, see what your are, weigh the risks and benefits. There's some people who shouldn't take hormones, and there's some people who have a higher risk if they
Don't. Yeah.
there's a decrease in diabetes, there's a decrease in heart disease, osteoporosis, lots of things that are improved by hormones. And then there's your own personal beliefs. So with that type of patient that would come in, we would evaluate everything. We would look at your thyroid dose. We're also very intentional about like when you take your thyroid medicine and test the blood test. Like a lot of times people aren't really told like they're just like randomly going to get these levels done. And so we're kind of scientific about the pharmacokinetics of, well, if you take a thyroid medicine, we want to see what the peak level is when you take your medicine. How good are your levels because of the medicine? So that's just, kind of how we handle things.
Yeah, this is huge because I think traditional medicine doctor, they probably not going to check when your hormone peaks, which is
Yeah.
like huge in terms of like figuring out your dosing, when to take it to make the therapy actually more effective.
No, it's interesting because if we're talking about female hormones, the standard of care is to not check levels, to just give hormones and not monitor. If you look at the standard of care for men, it's check levels, give testosterone, monitor levels. If you even look at the standard of care for transgender therapy, check levels, give hormones, monitor levels, but not for us women. Why are we different than either of those two circumstances? It's so maddening.
It's crazy. We also have a couple people asking for the thyroid test kit. I guess they can message you, DM you after.
Yeah, they
This
can mess. I think on also the link to the thyroid workshop is also on Hormone Guru MD. It's my practice Instagram. I think this one's my Dr. Tara Scott. So you can go there. It says upcoming thyroid workshop. If you sign up for the workshop, the call is on Thursday. You're not going to get the test kit before then, but you will still get it. And the call will be recorded. So even if you wanted to wait until you got it and then watch the recording, that's also fine.
So this would be really beneficial for anyone who's interested. Please sign up.
I think so. I think even if you miss it, I think we'll probably keep it there as an after, even if after the fact, if people wanted to sign up, get the test kit, and we usually keep the discussion board open for a little bit as well.
Wonderful. I know we're a little bit over. There's one more question. Do you have another couple minutes?
I have another minute or so.
Okay, so are hormone tests more accurate through blood or saliva, in your opinion?
That's a really great question. And so what I say is it depends on what you're trying to test and what the patient is. I personally use all types of testing. If I have a teenager come in, I'm going to do blood testing. If I have a 45-year-old, I'm going to start with blood testing. If you come to me and you've had a hysterectomy, but you still have ovaries, I need to do blood testing, right? If I'm checking thyroid, only blood. If you have no ovaries, then it's not going to make sense for me to do blood testing because there's no ovaries producing it. So I might start with saliva because your hormones are renal glands and they're converting in your muscle and fat, and that's where you're getting your hormones. So I feel like that is when saliva. I also do quite a bit of dried urine testing as well to look at your metabolites. And there's also something called blood spot testing. So I'm a little leery of the practitioner that says this one is the only testing, only do saliva, only do urine. I personally do all of them because they tell you a different story. It's like a different room in your house.
Yeah, this is huge. We're gonna have to invite you back on even just to talk about like a lab testing, like what type, because oftentimes people use direct to consumer tests, they're like totally confused. And then the test and they order might not actually be fitting the purpose.
Well, that's so true because when I have people come in and they say, here are my tests, I'm like, well, where were you in your cycle? They're like, what? Nobody told me to collect them. They're paying for these testing and they're collecting the wrong time of their cycle, and then they're out the money for the direct to the consumer one. So that's definitely a problem, and that's why we're trying to work this out to educate you, to let you know, so you can collect them at the right time.
Amazing, amazing. So thank you so much for all this great information, Dr. Scott. And everyone, please follow Dr. Scott at Dr. Tara Scott, and then like sign up for the workshop and check out the free resources. And then we'll keep everything in the LinkedIn bio so people can find you.
Yeah, and that's at hormone-guru.com. That's where all the courses are. And thank you so much for what you're doing to spread awareness about the environment. That's so important. And I would say most practitioners don't have a lot of knowledge about that. So I'm glad that you're doing that. And I appreciate you giving me the opportunity to spread a little bit of knowledge as well.
No, thank you so much. We're going to have to invite you back. This is
Sure.
amazing.
Okay.
Thank you so much. Bye.
Bye-bye.